you like this one, like you're doing this. Do you get the idea? Okay? So I'll be looking at your face, Mr. Jones. Guys, speak in this way. So I don't look like in a weird way. You have to tell the patient I'm looking. Because some of you are doing this, don't do this. Do you get the idea? You have to talk. So I'll be looking at your hands now. Now I'm looking at your face. Okay? Don't give any comment. Thank you. Because some of you say I can see my face. Don't talk. Do you get? Just to observe. Do you get? Okay. So what will happen now? Of course, in the face, you want the muscles and the blinking, and also listen in terms. Okay, Mr. Johnson. Now I'll ask you kindly to stand up, and I will ask you kindly, because guys, you'll say the whole story. Okay, I'll ask you kindly to stand up and take some few steps for me. I will be observing your gait while you are walking. Guys, what you're saying is quite important. Okay, I will ask you kindly to stand up and take some steps for me. I will be observing you while walking, and I will be behind you to protect you from any falls. Do you get? So I will kindly ask you to stand up and take some few steps for me. And Mr. Johnson, I will be observing you while doing that, observing your gait, and I will be behind or around you to ensure that there is no, or you don't have any fall or any issues. So can you please do that for me? That's how you speak. Can you please do that for me? Do you get? Okay. So guys, patients will stand up. Now we have two options happening. Online, I think you can see, right? Okay, good. You feel shy?
No.
Okay, that's fine. So guys, first of all, this is the first thing that you're going to come in this way. And she will start walking. While she's come here. While guys she's walking, what you're going to observe, be here, because all of you are looking, you know what you're looking at. Because you're not doing it really. Observe the gait in that way, okay? You start walking, so she'll take the few steps in that way. Come here. I will now do it in front of you, but I mean, are you getting the idea? Either this or this. This way. Do you see this? This is also correct. Do you get the idea? When you do this, don't go so close, because some of you are annoying. Do you get the idea? You have to be like in that way. Do you get what I mean? Like make the patient feel comfortable. And that's why I always say come in this way, so the patient will not feel annoyed. They get so either in this way and maintain some space. Don't touch in that way, okay? In that way or in this way, and you're moving with them. Do you get? So come that way. Let's say because the other one is. But I'm going to look at. Okay, you can take a few steps now for me. You observe the gate. Can I ask you kindly to just turn? You can turn now. Take a few steps. Are you getting it? So I observe the gate. In the exam, he'll be having shuffling gait. Like you see, he's taking a very, very small steps. Like you will see, he'll be like this. Like you get the idea, this shuffling and slow and disturbed gait. Do you get the idea? Okay. So are we done with the gate now? What you will do? Okay, Mr. Joseph, perhaps. See how many steps I said. How many steps? 5, maximum 6 steps, because they're going to allow him to walk till the end of the room. Especially in the street, you know, the room is quite big. The room in the square, I can understand the room is small. In the street, the room is big. You not walk till the end. Don't cause distress for the patient. Just a few 5 steps, good to observe. 5 steps going, 5 steps coming back, and be after him. I told you. Do you get the idea? Okay. Online, are you following? Online, let me allow you to unmute yourself and speak so that you can talk. Okay. Next. No, bring the chair. So what you'll do now, okay, Mr. Johnson, so now I will ask you to do some movements for me. Guys, what are those movements? Those movements are for mainly what? Bradykinesia and rigidity as well. I will tell you now. So guys, first of all, we have something which we call toe tapping. This is the first thing. I will talk about this now, okay? And we have something which we call what? Open and closed fists. Those are the two main things. Of course, also we have pronation and supination, but leave it for now. I just need those. Toe tapping, open and closed fists. So what you will say? So Mr. Johnson, now give the instruction very clear, okay? I will ask you to open and close your fist in that way, as fast as you can, as wide as you can. Do you know, guys, what will happen? It will be in the beginning, in the exam, you see it. In the beginning, it will be fast and very wide, but then it will be what? Smaller and slower. That's what this is what basically bradykinesia. Do you get the idea? So you explain. So just I ask you kindly to do this for me. So please open and close your fist. Show him in the exam. Don't just speak. As fast as you can, as wide as you can. Can you do that for me? 10 repetitions are enough. Okay? And listen to me very well, one by one. Never ever do with each other. One by one. You get the idea? So I ask you kindly to open and close your fist in that way, as fast as you can, as wide as you can. 10 repetitions are enough. Guys, allow the patient to start after you finish. For example, what she did is wrong. They get they will start after you finish everything, because if they do that while you are talking, you're not good. Do you get? So, Mr. Joseph, please try to follow this instruction. Open and close your fist as fast as you can, as wide as you can. 10 repetitions are enough. Please go ahead. 1, 2, 3, 4, 5. Beautiful, you can rest. You do that with the other hand. Is that as fast as you can? You are doing like you are actively doing it. Okay. Yeah. But guys, I mean the instruction should be clear. Fast and wide. Wide means like as much as they can in this way. Because some down there in the exam they do it in that way. This is wrong. As fast, as wide as you can. Do you get the idea? Okay. So now Mr. Johnson, do that with your fingers. So we do now the fingers tapping. As fast as you can, as wide as you can. Then repetitions are enough. Guys, why do we do the fingers? Because some people are having osteoarthritis and stuff, so the fingers will be more accurate for you. Do you get the idea? Is that the right? Do it fully, do it for me. No, this. The finger tap. Yeah, it's okay, that's fine. Do it, don't do it again. 1, 2, guys, count for them, so it's 10 or enough. Good. Okay, thank you. You can do that with the other one. Yes, you don't thank you, you can rest. Guys, of course, don't count for 10, just 7, thank you, enough. 6, 7, that's it. But you just say 10, it's not enough. So are we done with the upper limb? That's it. Any question regarding this till now? Offline? Online? Okay, now let's go for what?
So still wasn't clear about during the examination. I didn't notice that you could.
Yeah, there's nothing.
Wow.
You'll be surprised inside.
Wow.
You get the idea, there's nothing. That's why I'm telling you, you'll be surprised if you don't know. Like when I say I would like to examine, you can check, he'll say, doctor, please examine, go ahead. He will stand up.
This is the only one you can follow up to do the examination.
And follow up, but not all the part 2. I told you we have this ankle sprain. I told you the list before. But I will talk about it again, no worries. Okay, let's go for what? Lower leg. Go back. Okay, guys, so we did that. Go ahead. Okay. So just make your shoes appealing for the online. Okay. So, guys, what do we have now? This lower leg. What do we have in this lower leg? Guys, first of all, we have the toe tapping and we have the heel tapping. We'll talk about this. Of course, guys, excuse my socks. Okay, because I will talk about that. So first of all, guys, what do we have? We have this. This is the toe tap. This is the heel tapping. Okay, and we have this. Look at the screen. One. So you get the idea. So that's the first thing, and this is the second thing. So now you get the instruction. So I went first. What we do? First toe tapping. Same story. So Mr. Johnson, as fast as you can, as high as you can. You can go ahead, please. 10 repetitions are enough. Right? You do that with other legs. Thank you. Yes. Now, so I'll ask you to do this heel tapping. So, as fast as you can, as high as you can. Don't put your hands. Go ahead. Don't. Yes, do anything. Go ahead. Exit. Guys, are getting the idea? Of course, she should be higher than this. You are high. Yeah, that way. Guys, getting the instruction should be clear. Because, guys, the more you're doing this means what? First, no rigidity. Second thing, body kinesia. As I told you, you get the idea? So, as fast as you can, as high as you can. You get the idea? Yeah, go ahead. Excellent. Thank you. Rest the other one. Thank you. Guys, you know what I mean? That's for the upper limb and lower limb. Any question regarding those two? Good? Okay, now the last part of the examination. Which is what? Guys, the last part is mainly for what rigidity now. So what did we assess? We assessed first of all the gait. We assessed the face, masked face and the tremors. We assessed the bradykinesia by the toe tapping, the open and closed fist for the heel tapping and toe tapping. Now we have rigidity. Rigidity, I'm going to touch the patient. Okay, Mr. Johnson. Now I'm going to touch you to apply some tests. Okay? So guys, what do you listen to me very well? Of course, you have to say, so Mr. Josh, now I'm going to touch you. Is that okay for you? Don't touch like this. Ask consent. I want to touch you. Do you have any pain? Any issues touching you? No problem. Can I ask you kindly to rest your arm for me fully on my hand? Guys, you can, of course, you can feel the weight of the arm of the patient on your hand literally. You get? Because sometimes they will say that you are not listening literally. Can you see? Now I'm feeling the weight of her hand. You get what I mean? So allow her to, just allow him, to rest fully. So you are feeling the weight of the arm in your hand. You get the idea? Okay. Now, what you're going guys to do? We want to fix this, the joint here, and we want to start moving it. So see how I'm coming from here. Don't do this. This is not working. You get to come from here, like interlock. You get the idea? So I'm trying now to move it. I can find this quite flexible. So guys, what do we do now? We do what we call activation test. Like this activation test. Why guys this is flexible? Because she's focusing here. Like she's putting all her concentration here. That's why it's flexible. So what do we need to do now? Distraction tests. We want to distract the patient. So what do? We will ask the patient to what? Tap on the thigh as fast as you can, as high as you can. You can go ahead, please. Now I can see the rigidity already. She's having it already, to be honest. You get the idea? She's having it. You get the idea because she didn't focus here anymore. You get again. So I ask you kindly to rest your arm on my hand fully. Oh, you are pressing. Don't press like just press it normally. Yeah, excellent. Do you get the idea? So I can feel the weight of your arm. Okay. So now I'm going just to touch you. Just bear with me. Okay, I can find this quite loose. So I ask you kindly to start tapping on your thigh as fast as you can, as high as you can. I can appreciate the rigidity now. Don't miss it. Don't miss it. Okay, go ahead now. You're moving with each other, you can't move in direction. That's fine. Okay. So you do that now, you're going to feel, of course. Okay, this is in that way. Do you get the idea? That's it. Thank you. Are we done with this? No. Now we're going to go with the elbow. And go in this way, sit down in the exam in that way, okay? So now I'm going to do that with this one. So guys, what you will do, same story here, in that way, with the elbow. Do you get the idea? In that way. Don't move. I'm doing it, don't move. Do you get the idea? So in that way, guys. You get? Yeah, your hand is loose. I'll ask you to do the test for me. Go ahead. Now I believe it's loose. Sorry? No, you don't say that. You explain. So can I ask you to do the test for me? This just to check. Don't say anything. So they will do that. You get? Yeah. Go ahead. Yeah. Yes. So you find that this loose is quite rigid here. She's not able to maintain like this without moving this. Do you get the idea? Yeah, in that way. Of course, same story, guys. Do you know what you can do to make it easier for you? Put in that way. Don't come here, but don't avoid hitting the patient's face. No, I mean it because I can hit her face. Do you get the idea?
There's no fixed way to do it.
No, the most important is interlock here and interlock here. That's it. You want to interlock here and interlock here. Do you get so that you can check the rigidity? So come in that way. If you feel you're going to hit the patient, come here in this way, no problem. But the idea in this way is better, so that you can control it fully.
Can you hold the wrist again?
Yeah. So you're going to rest here. What you will do now? Come here. This is the easiest one, guys. This is the easiest one. So do the activation test for me. Okay, that's fine. No problem. Okay, sorry guys. Sorry. What? Are you doing it in the air? Like do it in your hands. Do it in your thigh really. Do it really. You get? Do it really now. Guys, because in the exam they might do that, so they can't do this. Sorry. Okay, guys. So you have to do it correctly. You get? Go ahead now. You get in that way, tapping. You get the idea, then come again in this way here. Good? Okay. Now I go to the other side. Come here. I go to the other side. Have a seat. So what we'll do, same story. Come in this way. Activation test. Yes, sometimes you can see this. Same story here.
আচ্ছা
That's it. We are done. Ideally, guys, we have to do that also with the lower limb, but we don't do
আচ্ছা
it for the
ওকে
exam.
তেরবেলা দেখো
No need. That's it. Oh, come on. Very common. Very common. Very, very common. But I don't think that to do that. No, you don't worry. Do you get? So guys, I will do again all the steps from the beginning, okay? Can someone try and do it? Can you count Pancha?
Me?
Do you want to try?
Not this time.
Okay. Can you count Pancha? Do you want to try? Why you don't talk? Because it's your birthday, you know. So you can come. Yeah. No, have a seat. She'll on you. Okay. No, go there. Allow the online to see you. Yeah. Should I say it out loud or should I do it like I'm supposed to do the exam? From the beginning of the examination. So, Mr. John, I will be looking at your face and I will be looking at your hand. I request you to rest your hand on your thighs. So, I will be looking at the face. See, did she take enough time to look? No. Take your enough time. Make it real. I can't have it. So I will be looking at your face. I will be looking at your face and I will be looking at your hands. Okay, thank you. Now, can you please? I will be doing some movements, and I request you to repeat them. So, just your hands, you have to open it as wide as you can, and you have to close it as fast as you can. Can you do this for me, please? Okay. Take the numbers. That is one. Thank you. Do the same thing with the other hand as well. As fast as you can, as wide as you can. Okay. Thank you. Now, I request you to use these two fingers, touch them, and then open them. Okay. So do it as fast as you can and as wide as you can. You can repeat it for 10 times. Can you please do it? Stop doing it with the patient. You have to observe the patient. Like don't do, observe the area. Next. Your other hand, please. Go ahead, no problem. Carry on. Okay. I wish you forgot the gate. Do it anytime, no problem. Okay. Now I would request you to do some movements with your legs as well. So can you please tap your feet as fast as you can, as high as you can. Can you do it for me, please? Repeat it 10 times. So the other one is very please. Can you do the same thing with your heel as well? No. You have to show. Yeah, so as fast as you can and as high as you can. So, okay. Can you do it as wide as you can, as fast as you can? Is there getting the idea? Yeah. Now I will be checking your gait. I request you to stand up. I will be right behind you, so don't worry. I will make sure that you don't fall. Can you please stand up and take a few steps for me? Stand please. In that direction, take 4 to 5 steps. Yeah. Don't fall. Same time. You're not the problem. Thank you. Now, John, I will be touching you and I will be performing some I will be performing some movements. I will be checking the rigidity of my hand. Is that okay? Yeah. Can I do that? Yes. While I'm doing it, if you have any pain and you have any problem, kindly let me know and I will stop. Okay? So now I will touch you. Can you please rest your entire hand on my hand? Is okay. Yeah. Are you feeling the weight is there? Okay. So now I will fix your wrist. I will be doing it.
So that is fine. So while I'm doing it, can you please start tapping your right?
No, you have to show.
Okay, that is fine. Now I will repeat the same movement again. And when I'm doing it, I want you to tap your right hand on your thigh. Can you tap? Okay, please do.
Okay. Thank you, Donna.
Fine. I will be doing this same thing on the other hand as well. Can I just finish wrist and then do elbow, or should I like? So
Guys, finish always the same.
yes,
Yeah. Sorry? Yeah, this is the issue. That you're blocking the elbows.
So your biceps.
Excellent.
John,
You are pressing a lot, right? She's pressing.
yeah,
Press gently.
yeah. This is.
I think it's mainly anxiety, right?
Okay, so John, I will repeat the same movement again when I'm going to do it.
Don't do all of this, just tap the same. Tap again, please.
Can you please tap?
Because you're wasting your time. Did you guys reading the idea?
Okay.
Are you focusing?
Right.
Okay.
Same thing on that side. Can you start tapping, please?
You are looking good. Yes, excellent. Now you are holding it in a good way. Excellent. Why did you start on your own? Allow her to do the stuff. Yeah, go ahead.
Can you start tapping?
Yes.
again,
Automatically.
please? Okay. Now, same thing. I'm going to do with your elbow.
Yeah.
Can you tap for me, please?
Excellent.
Thank you. Thank you very much.
Guys, leave a comment. Let's all have your hand for her. Now give her the comment.
Would I keep this by going? Yeah, we can tell the patient done in the opposite direction.
Yeah.
Same
Yeah.
direction. Because it doesn't
The
sound
instructions. The instructions is the main thing. That the instructions are not quite clear. We can so try to make the instructions more clear. And guys, again, this is by the way something all of you are doing, that you press tightly on the patient. Don't avoid it. Because an anxiety. It's not because it's just an anxiety. You get, so press gently, please. In this way. You get, and then try to move. That's it. Thank you so much. Thank you guys for. Thank you, our actors. Okay. So guys, you're going online. Do you have any question? I hope you are good.
Hello, Dr. Ala.
Yes, please.
So, would be expecting this examination in both in the first